Hi doctors, focus 30 10th day and 10th module, and I'm going to upload one or two modules in alternate days. Okay, we have to complete the topics before 25th. Okay, last 4 days there won't be any modules of focus 30. I'll be trying to cover it maximum fast, and I'm planning for some topics in medicine, community medicine, pharmacology, microbiology, very important topics. I'll discuss that also. Okay, so today very important. Today topic is dy diagrams. So what is dy diagram? Darrow-Yanet diagrams. These are very important. Okay, very important. This was potential INA-CT type question. Now it is coming in NEET as well. So image based question it can come. Okay, so very important. dy Darrow-Yanet diagrams. Okay, dy diagrams. And CLN, definitely one question will be there from CLN. Carcinoma lung, definitely one question will come from there, and there are some spotters also related to community medicine today. So today this is the important topic. You can see what is this. This is very important medicine pathology. You can see something called keratin pearls here. You see keratin pearls in squamous cell carcinoma. So very important. So Darrow-Yanet diagram, carcinoma lung, and some spotters. Small module but very important. So now we are going to solve dy diagrams. So dy, how to solve this? So many students have confusion how to solve this. So question may they will tell like suddenly a student who drank 3 liters of water. So what will be the changes in dy diagram? So like that question will come. So how to approach? So for this to understand, there are some rules, some core concepts. What are the rules? Okay, so we know we have cells. So we have cells. Okay, we have cells. Cells are arranged like this. Okay, so cells contain intracellular fluid. Okay, cells contain intracellular fluid. So outside we have extracellular fluid. Okay, see, this is the basics. So intracellular fluids which are inside the cell, extracellular fluid which is outside the cell. So any changes, any acute changes happen, it first affect the extracellular fluid. So this extracellular fluid changes happens first. After that, the osmolarity changes. According to the osmolarity changes, ICF shift. This is the basic principle. Clear? The primary fluid compartment impact is ECF. The primary changes, all external changes directly affect the ECF, extracellular fluid, which is 1/3. Intracellular fluid is the 2/3 of total body water. Okay, so you should know the distribution of fluids also. So simple, you can see the box which is 1/3, with this box which is 2/3. So intracellular fluid which is 2/3 and extracellular fluid which is 1/3. So billions of cells. So intracellular fluid is the most, around 42 liter. Okay, 42 liter may 28 plus 14, we can say like that. Okay, so leave about that. Okay, leave about that. So total body water is almost 60. Iska 42 means almost 70%. So 7 into 6, 42. 42 ka 1/3 is ECF, that is 14. Like that divisions are there, you should know that. So here dy diagram, how to solve, you should know this. Okay, now I'll discuss that. So secondary, so the ICF is the secondary cellular reaction. So any changes in the ECF, the osmolarity changes, then ICF correction will happen. The sequence of events, always calculate or assess the changes in osmolarity first. So what I explained, just understand that, then it is easy. Okay, so what I explained, it is easy. So what happens? First there is changes in ECF. There is first changes in ECF. According to ECF, what happened? This osmolarity changes. This osmolarity changes leads to ICF change. So the sequence of events occurs in this order. So now we will go and solve. Okay, so first ECF changes, we have to see the osmolarity and ICF. And you should know one more thing before this. So we have two compartments. Okay, two compartment A, compartment B. Okay, so in this compartment there are more solute, here less solute, principle of osmosis. So here less solute mean it is hypotonic, this is hypertonic. So always mobility of the water molecule from hypo to hyper, here water concentration is higher, so higher concentration of water to lower concentration of water it is going. So that is very important. This is the principle of moving of water shift, okay, fluid shift. Okay, so keeping these two in mind, we are going to solve the dy diagrams. Now see, this is the single image. I had solved everything is here in a single page. So I had individually explained also. So we will individually explain and we'll come back. Okay, we'll come back. Okay, this is the summary. This 2/3 is ICF, 1/3 is ECF. Okay, now before seeing that, now I can see here there are few laws of isotonic fluid. So our according to our osmolarity, we have isotonic fluid, hypotonic fluid, hypertonic fluid. So I explained just before. Okay, these are very important. So according to these laws of fluids, which may be isotonic, hypotonic, hypertonic, addition of fluid, addition of isotonic, hypertonic, hypotonic, this will shift the dy graph. Now we will go and see individual one. Now we will see with the basic concepts. Okay, now laws of hypotonic fluid. So what happens in laws of hypotonic fluid? So this is our ECF. Okay, so this is our ECF. I had mentioned here, this is our ECF. This color is extracellular fluid, which is 1/3. Now I can see here. Okay, so here we are going to see laws of hypotonic fluid. Okay, so what happens? See, look at here. So what happens? Loss of hypotonic fluid in from the extracellular compartment, hypotonic fluid is lost, is out. Okay, loss of hypotonic fluid out. That means what happened? The volume is reducing here. The volume is reducing. So the volume is reducing. So you can see in the graph. Okay, in the graph it is mentioned clearly here that Darrow diagram में concentration of solute in the y-axis, volume in the x-axis. So volume. So here what happens? Because of loss of fluid, the volume is coming down in the ECF, because first change is happening in the ECF. The volume came down. So what happened? Hypotonic fluid lost. Correct. So hypotonic fluid lost. That means fluid with less osmolarity is left the area. Correct. So what happened? The hypotonic fluid is lost. The solutes are rich here. It becomes hypertonic. The osmolarity increases. The osmolarity increases here. Osmolarity increases here. So what happened? Fluid volume came down, reduced, because hypotonic fluid left. Osmolarity increases. So here, which is comparatively, here osmolarity is more, here osmolarity is low. What happened? Fluid will shift from here to there. Fluid will shift from here to there. Okay. So what happened? What happened initially? What happened initially? Here this much volume is reduced. Okay. So here volume is reduced to this. Okay. So this much hypotonic volume is gone. So osmolarity increased. So then what happened? What happened? Here the fluid will shift from here to there. So what happened? The fluid will shift from here. So the fluid is shift from here to there. So volume reduced. But here what is happening? What is happening? Osmolarity, which was initially some x value, it is increased to 2x value or 1.5x. So here the osmolarity increases. Okay, so here the osmolarity increases initially, and here because of fluid shift, here also osmolarity increases. So it is little confusing. Now I will explain. Just listen to this, your concept will be clear. Okay, listen. Okay, so we have some fluid loss, hypotonic fluid. So this much hypotonic fluid lost. So the volume graph shift to left. So volume came down. This much volume loss is there. This much volume lost because of hypotonic volume fluid loss. So what happened? So the concentration increases here. Concentration increases. That's why concentration increases here. So volume decreased, concentration increased. In the concentration or osmolarity in the y-axis, volume in the x-axis, volume decreased. So now you see here, volume decreased. osmolarity increases. Here low osmolar. So fluid shift will happen from here to extracellular fluid. From intracellular fluid to extracellular fluid, fluid shift is happening. Clear? So what happened? The volume came down. And because there is an osmolarity in the intracellular fluid, the volume is losing. Definitely it will become high osmolar and the osmolarity increases. So the final graph will be like this. So you can see this is the normal graph in the beginning. This is the normal graph in the beginning. But what happened later? What happened later? Loss of hypotonic fluid loss. So volume came to here. Because of volume loss, osmolarity increases, concentration increases. Okay. Then what happened? From here, this fluid is shifting here. So volume reduced in the ICF, and ICF ka volume went to ECF. What happened? Osmolarity increases in ICF. So the final graph will be like this. Okay. So we will discuss in the final layer. Symbol. Same thing we are going to apply in gain of hypotonic fluid. Symbol. Now we will see what happens in gain of hypotonic fluid. Okay. Now we will see what's happening there. Okay. This is little concept wise. That's why I'm explaining like this. Okay. Clear. Okay. Now see what happened. Gain of hypotonic fluid. Gain. So definitely gain means the volume will increase. Okay. Volume increased. Volume in the x-axis, concentration or osmolarity in the y-axis. Clear? So the volume increased. Hypotonic fluid ka volume increased means the osmolarity decreases because it is hypotonic. More water and the solute will be more diluted. So what happened? So this osmolarity decreases. Okay. So it will be like this. So you can see it is like this. Volume increased because of gain of hypotonic fluid, but the osmolarity decreased. The graph changed like this. Clear? Okay? Clear. Now, here osmolarity decreased. Okay, osmolarity decreased. Correct. So here it is high osmolar. Clear? So what happened? Fluid shift will happen from high osmolar to low osmolar. So here hypotonic volume, low osmolar, more water. Here high osmolar, fluid shift will happen from here to there. So what happened? The volume increases. I'll change the color. Okay, I'll change the color. So shift is happening from here because it is low osmolar, more water. Here hyper osmolar, low osmolar to higher osmolar. Where water content are more here, so fluid content is more. It will come back. The volume increased. So more water came. The solute will diluted. So what happened? Concentration come down. Clear? So finally, the graph. What change you can expect? The initial graph is like this. What happened? There is gain of volume. So volume here gained. Okay. So volume here gained. And because of volume gain, what happened? It's become low osmolar, and low osmolar means more water content. Water will shift here. So here also volume expands. Because of volume, water is coming. It's become diluted and concentration decreases. So the graph changes like this. Okay. Now you understood what I explained. Symbol. Okay, we will summarize in the last. So these are examples of loss of hypotonic fluid. Okay, so notes: hypotonic loss of sodium, net loss of water in excess of sodium. So increase in plasma osmolarity, decrease in total body sodium. So these are the explanations. Okay, what I told, it is written here also, very simple. Okay, it's little confusing. So we will go to the, instead of hypertonic, we'll go to the isovolumetric contraction. Means same osmolarity, isotonic solution added or lost. So what happened? So isoosmotic volume contraction. What means? Volume is lost. That means initially the graph was like this. Because of isotonic volume, the volume came down. So the volume came to this much. And the osmolarity is same. There is no change in osmolarity. There is no fluid shift. Either and there is balance. No fluid shift. So what happened? The graph remain concentration ka y-axis remain same, but the x-axis may volume loss is there. That's why it is coming small. So the graph will come like this. Clear? Clear? Symbol? Clear? Okay. Now isoosmotic volume expansion, same application. Here what happened? Extracellular fluid may ECF may what happened? Extra fluid is coming, which is isotonic. Definitely the volume is going to rise, volume increase because of the isoosmotic. No osmolarity changes, so there is no fluid shift. So what happens? This graph increases this much. Symbol. So this is isoosmotic volume expansion and isoosmotic volume contraction. Okay, symbol. Clear. Now we already discussed about hypotonic fluid. Now we will discuss about the hypertonic fluid and what is happening. Okay, so now we are going to see that. Okay, so hypertonic fluid means high solutes are rich. Okay, so imagine ECF have some solutes. Okay, and here what's happening? Loss of loss of hypertonic solution. Okay, loss of hypertonic solution. So what happens here? Loss of hypertonic solution. So volume is reduced. Correct? Because some loss and loss of hypertonic, more solute went. So here osmolarity fall down. Okay, clear. So definitely what happened? So much fluid loss, osmolarity fall down. Okay. So what happened? Osmolarity also come down. Clear. So graph will become like this. Okay. So graph become like this. So imagine osmolarity came down, volume came down. Here is low osmolar, and here is high osmolar. So what happened? Here fluid shift from low osmolar to high osmolar. Low osmolar means more water content. The water will shift from here to there. Extracellular fluid to intracellular fluid, and the volume slightly increases. Because of the volume increases, the osmolarity will come down because more water came, solute become diluted. Simple. The graph will become like this. See, the graph will become like this. Very simple, right? See that you can see from here. Clear? Now same scenario we will see with gain of hypertonic fluid. Definitely gain of hypertonic fluid. So gain means the volume increase. So gain means some volume increased. Definitely hypertonic volume, hyperosmolar volume increase. That means the concentration also, osmolarity also increases. Clear. So ECF ka hypertonic fluid intake gain means volume increased, osmolarity also increased. So here it is low osmolar, here it is high osmolar. Definitely fluid shift from here to there. Okay, so the volume increases. Okay, so what happens from ICF to ECF fluid shift? The volume will come down. Came down. Volume came down. When the fluid shift, intracellular fluid ka solute become more concentrated, osmolarity increases. Simple. Now the final graph is like this. You can see here. See, the final graph shifted like this. Okay. See, simple. This is very simple concept once you understand. Now you will go to the summary of this. Okay, in the front page, but wherever I discussed. Okay, so now you see here. It's very simple. Okay, so it is very simple. Okay, now you see here. So this is our intracellular fluid, 2/3. This is our extracellular fluid, 1/3. Okay, so definitely if here is more osmolar, high osmolar mean more solute. Here will be more water. Then water will shift from here to there. Simple. Okay, and x-axis, y-axis, here volume, here concentration. So any volume gain, this graph will shift here. So volume gain means graph will shift here. If it is hyperosmolar, osmolarity also will be high. If it is low osmolar, this osmolarity will come down. If it is isotonic, it will be in the same line only. Simple. So imagine hyperosmolar solution gain mean here osmolarity increases, low osmolar water will shift from here to there. We describe. So now you see here Loss of isotonic fluid. Loss of isotonic fluid. Isotonic. So just nothing will happen. The graph will shrink in volume. That's all. Clear? Gain of isotonic fluid. Volume just shifted forward. No osmolarity changes because isotonic. Same osmolarity. Clear? That is clear. Next, we are going to see the next one. That is loss of hypotonic fluid. The fluid loss is there. So what happened? The volume came down. But hypotonic fluid, water is lost. It become more osmolar. Extracellular fluid become more osmolar. The osmolarity increases. And because of it is high osmolar, from low osmolar where water content is more in ICF, fluid is shifting from ICF to ECF. That's why the volume decreased. Whenever water leaves the ICF, the solute become more concentrated. So osmolarity increased. Simple. Okay, clear. So what is happening? Gain of hypotonic. Gain means ECF volume increased. Okay, ECF volume is increased. Hypotonic fluid, definitely the osmolarity came down because diluted. So here it is more diluted, hypotonic. So here water content is more. So fluid will shift from here to there. So the volume of the ICF increases from ECF from ECF water is going to ICF and the ICF volume increases. Because of the volume water is coming, intracellular solute become diluted and the osmolarity came down. Simple. Okay, clear. Now loss of hypertonic and hypertonic. So what is happening? Loss of hypertonic. Now you see here, hypertonic is lost, so volume reduced. Okay, and hypertonic, excess solute lost. So finally what happens? Finally? The solute concentration, osmolarity reduces. Because of high osmolar solutes are leaving, osmolarity decreases. It becomes low osmolar. So what after so osmolarity decreases, volume decreases because loss of hypertonic solute. So fluid. So fluid shift will happen from here to there. That's why the volume increases in the ICF. So ICM water is more, solute become diluted. So it's become less osmolar. The graph is like this. Clear. And the last one, gain of hypertonic fluid, definitely the volume increased here. And gain hypertonic, definitely the osmolarity also increases. Clear. And what happened here? It is so many solutes are there, hypertonic. So water or fluid will shift from ICF to ECF. So what happened? The volume decreases here. Because the water is escaping from here, the solute become more concentrated, become more osmolar, and the osmolarity increases. This is a summary of dy diagrams. Clear. Okay, done. Simple. So I had explained it in detail. Please watch it. You will never forget this concept. Okay, there are 2 to 3 core concepts. It is easy only. Clear. Now I am going to discuss about something called CA lung, carcinoma lung. Okay, carcinoma lung. Every year there is a question from this area, and just from these two slides, one question is sure, and they can ask 2 or 3 from general whatever. So CA lung is associated with general pathology also, pathology, medicine. This is very important. We know CA lung, it is of squamous type, squamous cell carcinoma, adenocarcinoma, small cell carcinoma, and large cell carcinoma. So we have squamous cell, small cell, adenocarcinoma, and large cell. Okay, these are very important, and regularly they are asking. So this is important because you should know some differentiating points in this. Squamous cell carcinoma, we know squamous cell, multiple times we had seen. You can see the keratin pearls, it's nothing but squamous cell carcinoma. Adenocarcinoma, glands, you can see glands here, so many glands and stains, you can see here, pathology, pure pathology. Okay, clear. So this is very important. Okay, small cell carcinoma, it's nothing but small cell carcinoma. You can see there is a classical explanation for small cell. There are small cells, salt and pepper chromatin. We will come to that point. So what I am going to say, for every cancer there is a typical character. For example, we'll see. So we will see from beginning. So we know these are the cancers, CA lung and everything. Now we will see. So adenocarcinoma is more common in females. All are more in males. So adenocarcinoma. So we should give ADI to female. So females adenocarcinoma more. I don't know why you are hitting them. but majority of the time it is happening like that. But never there is no violence against women. But example I am telling. So females, adeno, adi, no. So I can make like this: don't hit them, adi, no, don't hit them. So females are more, okay. Don't hit females, adi, don't hit, no. So whatever you can make like that, okay, simple. So females are more incidence in adenocarcinoma. Adenocarcinoma, females have more incidence. Clear? Simple. Okay. And we have very important another point: smoking association. Okay. So the strongest smoking association with small cell carcinoma, small cell, which is having strongest association with smoking. So small cell, strongest smoking, S. So small is not small, he is strong. Okay. So strong association with smoking. So people are smoking, large person is smoking, small person is smoking, squamous is smoking. What happened? The small person ko we cannot neglect. The small person, which is small cell, strong association with smoking. So small, strong, smoking. Small is not small, small is strong associated with the smoking. So this is a potential question. So many noises in the morning when I take video. So now we can see smoking association strongest with the small cell carcinoma. And we should know something called paraneoplastic syndrome. Okay, paraneoplastic syndrome, this is very important. All these cancer have some, this will produce some proteins, peptides. Okay, these are known as paraneoplastic syndrome. For example, squamous cell cancer, they produce parathyroid receptor peptide, resembles peptide. Okay. So PTHRP. So this causes something called hypercalcemia because of parathyroid hormone resembling protein. Okay. So this causes hypercalcemia. This is the paraneoplastic syndrome in the squamous cell carcinoma. This is important. So we will come to that point also. And adenocarcinoma, which is more common in females, and these are non-smokers. So usually think females are non-smokers and they have high chance for migration. Like if you are not good, the girlfriend will leave you and will go to the other person. So migratory thrombophlebitis. So adeno, don't hit, no adi, no hit to females, no violence to woman, which is more common in adenocarcinoma. Incidence is more common in women, and they are usually non-smokers and they will migratory thrombophlebitis. When the boyfriend is not good, they will go. It's not always correct. Okay, just for understanding I am telling. Small cell cancer, what happened? This is having strongest association with smoking. This have paraneoplastic syndrome known as Cushing syndrome and SIADH, symptom of inappropriate secretion of ADH and Cushing syndrome. So you can see two are here: Cushing syndrome and SIADH, small cell cancer. Okay. Large cell cancer, that is not usually asked, gynecomastia, large. Okay, large breast, gynecomastia in male, breast enlargement. Clear. This is also very important. Now you can see here, most common paraneoplastic syndrome is hypercalcemia. Hypercalcemia is the most common paraneoplastic syndrome. And the most common cancer associated with paraneoplastic syndrome is small cell carcinoma. Why? Because here already it is producing Cushing syndrome and SIADH. So that's why small cell carcinoma, which is not small, he's a big person, he is producing most number of paraneoplastic syndrome, strongest association with smoking. Very important. Okay. Clear. Now we'll see the individual characters of squamous cell. Squamous cell, we already know keratin pearl desmosomes, keratin. So keratin markers are cytokeratin, and there is pathogenesis with P53 mutation. P53. So you can see P63 and P40 are the ISC marker with the cytokeratin. Cytokeratin, nothing but the keratin pearls. Keratin, ISC marker cytokeratin, P63, P40, pathogenesis P53. Clear. This is important. Okay, very important area. And adenocarcinoma have KRAS, okay, ALK gene mutations. KRAS and ALK gene mutation. And here glands are lined by pleomorphic cells. Typical glands you can see. And the ISC marker are TTF1 and napsin A. TTF1 and napsin A are the ISC markers. Okay, important. Okay, now we are going to see The small cell carcinoma, small cell is very important. They have small cell, okay, small cell with the salt and pepper chromatin will be there and proper prominent nuclei will be there, okay. And small cells, salt and pepper chromatin, nuclear molding and asopadi effect, okay. This is very important. And all these small round blue cells tumors, the markers are NSC, synaptophysin and chromogranin. NSC, synaptophysin and chromogranin. This is important. NSC, chromogranin, synaptophysin. These are very important because these same ISC markers are coming in all small cell uh, nucleated cancers. Okay, small cell cancers. This is important. It is there in GAT. It is there in different areas. This is very important. So this small cell, which is having strong association, which is having most number of paraneoplastic syndrome, and that is why he is having the worst prognosis and chemosensitivity. This is worst prognosis, very important. So this much is from carcinoma lung. We should know this carcinoma lung classification. We have squamous cell, adenocarcinoma, small cell, and large cell. So large cell, though you leave it, don't worry, they won't ask that much large cell. Squamous cell, keratin 12, cytokeratin P53, and ISC markers are P63 and P40, which is important. And hypercalcemia, which is the most common paraneoplastic syndrome, which is caused by the squamous cell. And the cancer with most number of paraneoplastic syndrome is producing is small cell carcinoma with Cushing syndrome and SIADH. And small cell, which is not small, is having strong association with smoking, and it is having small cells, pepper, nucleum differences, and NSC, synaptophysin, and chromogranin. That is important. Okay, clear. And when it comes to adenocarcinoma gland, so pleomorphic glands will be there. Adeno, no violence to women. Females are more common. Females are usually non-smokers, and females will migrate when you are not good. For just example, so migratory thrombophlebitis common. Okay, glands is lined by pleomorphic cell, and TTF and NAPSIN. These are the markers. So these two slides are very important for your CA lung, which is a definitely sure short question. One question without carcinoma lung is not there in NEET PG exam. That is sure. Till now it is there, and this year 180 question it will be like that only. You should know, especially the markers, these associations, and everything. So almost every year, either from pathology or from the medicine, both are same. This question is coming. This is very important area. Okay, this is the summary I have taken from the another note. Okay, you can refer this also, and you can see the adenocarcinoma. You can see the cells, glands, and pleomorphic cells and glands. You can see here. Okay, you can see the pleomorphic cells and glands. You can see the small cell lung cancer. See, you can see the small cell with prominent nucleus and salt and pepper chromatin and asopadi effect. This is very important. Okay, large cells, large pleomorphic cells. You can see large cells. Usually they want us keratin pearls in squamous cell carcinoma. You can see the keratin pearls. That's why cytokeratin positive and P53 mutations are there. That's why P40 and P63 are the markers with the cytokeratin. These are very important. So CLN is also very important. You should know. Now I come up with some spotters, especially in the community medicine, some programs. This is usually they are asking and people are getting doubt and is losing. Okay. So just some programs I will discuss. You can see okay, Ujala, Ujjala. So it is different. Ujala. So Ujala, blue color one. So Ujala scheme, Ujjwala is related to something called fire. Okay, fire. So it's fire. Ujjala, Ujjala. So there somebody is taking something, thefting something. So Ujala means, what is the Ujala scheme? So it promote energy deficient lighting through distribution of LED lights. So it's nothing but you can see a light here. So you can see here. Okay. Now you can see here. There is a light bulb. So this is promoting LED bulb to save the energy. And so energy efficiency lighting through LED bulb. Ujala. Clear? Ujala, which is clear. Now you can see Ujjwala, you can see a gas. Okay, Pradhan Mantri Ujjwala Yojana. So provide access to safer cooking fuels, LPG. Okay, under Ministry of Petroleum and Natural Gases, providing LPG to everywhere. So you can see the Ujjwala scheme. You can see the another scheme known as Ujjavala scheme. So here what is there is a scheme to prevent human trafficking, especially women's human trafficking. So in India, lakhs of people are missing. Okay, every day thousands of people are missing in India. Prevent human trafficking, child abuse, and sexual exploitation, as well as support rescue and rehabilitation. Ujjavala scheme, you can see it under Ministry of Women and Child Development. This is also very important. So similar looking name, Ujjala light LED, Ujjwala fire LPG, Ujjavala whatever pronunciation. I'm little weak with pronunciation. So that is human trafficking, woman child theft, or sexual exploitation, prevention, rehabilitation, and care. Okay, this is very important. These three they are regularly asking you. You should know this. Now I come up with some more. You can see this here PMJ. They will give you this. They will give you this. Okay, so you can see 1, 2, 3, 4, 5. 5 leaves are there. 5 leaves are there. Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat scheme. This is very important. Okay, PMJ, Pradhan Mantri Jan Arogya Yojana, up to 5 lakh insurance coverage for per family per year. Okay, so no restriction or limit of any family size, age, or numbers. This is a government scheme. It is usually PMJ is going on. It's a great thing and it should be established in all medical college. It should be there and it should be like no restriction to people. Okay, it is very important. Okay, Ayushman Bharat scheme and Pradhan Mantri Jan Arogya Yojana. Clear? Next, you can see something here. There is a small tree-like fielding. You can see child, mother. You can see different leaves. This is known as Poshan Abhiyan. Poshan. Prime Minister overarching scheme of holistic nourishment related to nutrition. Poshan related to nutrition. So you can see here portion related to nutrition. So nodal Ministry of Health and Family Welfare. Target beneficiaries aim to improve the nutrition status children 0 to 6 years, adolescent girls, pregnant women, lactating women. So nutritional improvisation in portion scheme. You have to know the diagram. Clear. Now we will see, can see something called Lakshya. Lakshya you had seen in OBGY posting में labor room K sheets में. And you can see Pradhan Mantri Surakshit Madritva Abhiyan. Pradhan Mantri Surakshit Madritva Abhiyan. So 9th of every month, this is very important related to antenatal visit and all. Prime Minister Madru Vandana Yojana, mother and baby. You can see mother and baby, and they are Madru Vandana Yojana. Ma, not the fruity ma. It's like mother's absolute affection. And Surakshit Madritva Ashwasan. They are giving some ashwasan to the mother and family. And RKSK, Rashtriya Kishore Pediatric, Rashtriya Kishore Swasthya Karyakram. So Lakshya, which is seen in labor room, it is important. And Pradhan Mantri Surakshit Madritva Abhiyan, 9th of every month, ANC care. And Prime Minister Madritva Vandana Yojana, Madru Vandana Yojana, it is important. The logos are important. Mother's absolute affection scheme is important. Surakshit Madritva Ashwasan, there is providing some Ashwasan. And Rashtriya Kishore Swasthya Karyakram, this is also very important. So now we'll see Pradhan Mantri Madru Vandana Yojana. So Pradhan Mantri PMMVY. So provide cash incentive of 5,000 to pregnant women in 3 installments. So you see Pradhan Mantri Madru Vandana Yojana, Prime Minister Madru Vandana Yojana. See here. Clear? So 1,000, 2,000, 2,000. First installment in the first ANC. So it is institutional delivery and baby complete 6 weeks of vaccination. They are giving this incentive of 5,000 in 3 installment. Mother's absolute affection, MAA. So Ma. So mother's absolute affection, Ma. This is nothing but breastfeeding promotion. Mother and baby affection through the breastfeed. Imagine like that, and breastfeeding promotion and nutritional support like that. And Rashtriya Kishore Swasthya Karyakram. Kishore adolescent boys 10 to 19, boys and girls. Okay. So they are focusing more on them. Okay. So adolescent friendly health clinics are provided. Weekly iron folic acid supplementation is given. Menstrual hygiene in females. Peer education, sexual education, Satya approach. These are coming under RKSK, Rashtriya Kishore Swasthya Karyakram, RKSK. Clear? And we have Maternal health initiative, we have Lakshya in the labor room quality and improvement initiative. Lakshya labor room quality, that is very important. So labor room should be the provision of proper sterile equipments and everything should be there. That's why Lakshya related to labor room. And we can see Pradhan Mantri Surakshit Madritva Abhiyan. So Madritva Abhiyan, this is also important. Antenatal visit clinic on 9th of every month. So free ANC visit clinic held on 9th of every month. Okay. And color coded, patients are screened and categorized using colors. This also, so this can be a potential question in the NEET this year if they wanted to make little tough. Okay. And you should know this scheme, you should know that. See, you can see the 9th of every month. Okay. This is very important. So what are the color code? Green sticker, no risk factor. Red sticker, high risk pregnancy is red sticker. Blue, pregnancy induced hypertension is blue. Yellow sticker is comorbid condition. So this is the potential question that can come. Okay. So green is safe, no problem, no comorbidity. Red means high risk pregnancies. So if they will mention something and they will mention something hypertension, it is blue, pregnancy induced hypertension. Yellow color is comorbid conditions. So this is very important. So these programs are important. For some of the programs I mentioned, many programs are there that I will upload later. And as you can see, this and these logos are very important. You should know the Ayushman Bharat and Poshan. And this Ujjwala, this scheme you should know. Carcinoma lung is very important. These two, one slide and these two slides are very important. And Darrow-Yanet diagram I explained in detail. I took more time and explained. You watch this, you don't want to refer anywhere else, you can complete this. So these are the small topic, but these are the highly important topic. So I can say questions, 1 or 2 questions can come in this 2026 NEET. I cannot say more than 2-3. Carcinoma lung is a potential question. DY diagram may come or may not come. If it come, you have to score this because no one explained more than this. I had explained maximum way, maximum better way. Please watch it again and understand. And spotters also, they can ask one question. Definitely they can ask, and that theory also important. Okay. So thank you. I will be uploading one more video soon, and I will be covering everything before 25th of the August. In between, I am planning for some topics discussion in medicine, community medicine, like PSM, community medicine, that medicine and some surgery and all. But it is very tough for me. I'll try my best to do. Thank you so much. Okay.